Welcome back, viewers. Today's video is about the current topic of discussion around the globe. It's about the mental health. This topic is growing wide and wide around the world. Now, why is this such an important topic of discussion? Most of us face a period of crucial time to deal with the problems surrounding us, and if we aren't able to cope up, it may lead to several mental health problems. So, today we are here to help you clarify all your queries regarding mental health. So, let's get started. Mental health refers to cognitive, behavioral, and emotional well being. It is all about how people think, feel, and behave. People sometimes use the term mental health to mean the absence of a mental disorder. However, this link also works in the other direction. Factors in people's lives, interpersonal connections, and physical factors can all contribute to mental health disruptions. Looking after mental health can preserve a person's ability to enjoy life. Doing this involves reaching a balance between life activities, responsibilities, and efforts to achieve psychological resilience. Conditions such as stress, depression, and anxiety can all affect mental health and disrupt a person's routine. Although the term mental health is in common use, many conditions that doctors recognize as psychological disorders have physical roots. The WHO stress that mental health is more than the absence of mental disorders or disabilities. Peak mental health is about not only avoiding active conditions but also looking after ongoing wellness and happiness. They also emphasize that preserving and restoring mental health is crucial on an individual basis as well as throughout different communities and societies the world over. Risk factors for mental health conditions. Everyone has some risk of developing a mental health disorder, no matter their age, sex, income, or ethnicity. Social and financial circumstances, biological factors, and lifestyle choices can all shape a person's mental health. The following factors may contribute to mental health disruptions. Continuous social and economic pressure. Having limited financial means or belonging to a marginalized or persecuted ethnic group can increase the risk of mental health disorders. Biological factors. The NIMH suggests that genetic family history can increase the likelihood trusted source of mental health conditions as certain genes and gene variants put a person at higher risk. However, many other factors contribute to the development of these disorders. Common mental health disorders. The most common types of mental illness are as follows: anxiety disorders, mood disorders, schizophrenia disorders. Anxiety disorders. According to the Anxiety and Depression Association of America, anxiety disorders are the most common type of mental illness. People with these conditions have severe fear or anxiety which relates to certain objects or situations. Most people with an anxiety disorder will try to avoid exposure to whatever triggers their anxiety. Mood disorders. People may also refer to mood disorders as affective disorders or depressive disorders. People with these conditions have significant changes in mood, generally involving either mania, which is a period of high energy and elation, or depression. Schizophrenia disorders. Mental health authorities are still trying to determine whether schizophrenia is a single disorder or a group of related illnesses. It is a highly complex condition. Signs of schizophrenia typically develop between the ages of 16 and 30 years. Trusted source, according to the NIMH. The individual will have thoughts that appear fragmented and they may also find it hard to process information. Now, what are the early signs? There is no physical test or scan that reliably indicates whether a person has developed a mental illness. However, people should look out for the following as possible signs of a mental health disorder: withdrawing from friends, family, and colleagues, avoiding activities that they would normally enjoy, sleeping too much or too little, eating too much or too little, feeling hopeless, and much more. So, what can we do? What's the treatment? There are various methods for managing mental health problems. Treatment is highly individual, and what works for one person may not work for another. Some strategies or treatments are more successful in combination with others. A person living with a chronic mental disorder may choose different options at various stages in their life. The individual needs to work closely with a doctor who can help them identify their needs and provide them with suitable treatment. So, this was just a briefing about mental health. If you want to know more, kindly write it down in the comment section. Thank you.